The next topic we have is melanoma. It's another type of skin cancer. Yesterday we talked about basal cell carcinoma, which is cancer in the lower part of the epidermis. We just talked about squamous cell carcinoma, cancer in the middle to upper part of the skin. Melanoma is cancer in the melanin producing part of the skin, the part of the skin that is responsible for the color. Next slide. So melanoma, the most serious type of skin cancer, develops in the cells melanocytes that produce melanin, the pigment that gives your skin its color. So it's the color producing part of the skin. Melanoma can also form in your eyes and rarely inside your body, such as in your nose or throat. The exact cause of melanomas isn't clear, but exposure to UV light increases your risk of developing melanoma. Symptoms: melanomas can develop anywhere in your body. They most often develop in areas that have most exposure to the sun, such as your legs, arms, and face. Melanomas can occur in areas that don't receive much sunlight as well, such as the soles of your feet, palms of your hand, and fingernail beds. These melanomas are more common in people with darker skin. Next slide. Causes. What causes melanoma? Well, basically, it's a mutation in the DNA. Melanomas occur when something goes wrong in the melanin-producing cells that give color to your skin. Normally, skin cells develop in a controlled and orderly way. Healthy new cells push older cells towards your skin surface when they die and eventually fall off. But when some cells develop DNA damage, new cells may begin to grow out of control and can eventually form a mass of cancerous cells. Just what damages DNA in skin cells is just what is unknown, and how this leads to melanoma isn't clear. It's likely that a combination of factors, including environmental, genetic factors, cause melanoma. Still, doctors believe exposure to UV light is the main cause. So, as I said, what happens is usually your cells produce like these new skin cells, and they push the older skin cells up until they fall off. What happens is the cells don't fall off and they continue living longer than they're supposed to. It's cancer. Next slide. What puts you at risk of melanoma? Fair skin, light pigmentation, because they have less protection from UV radiation. History of sunburns. One or more severe blistering sunburns can increase your risk of melanoma. But your skin is more at risk. Excessive UV light exposure. We already acknowledged the fact that it is believed that it is the most common cause of melanoma, or put you at more risk at least. Next slide.
Having many moles or unusual moles. Having more than 50 ordinary moles on your body indicates an increased risk of melanoma. A family history of melanoma. If a close relative, such as a parent, child, or sibling, has had melanoma, you have a greater chance of developing a melanoma too. And weakened immune system. People with weakened immune system have an increased risk of melanoma and other skin cancers, such as squamous cell carcinoma or basal cell carcinoma. Your immune system may be impaired if you take medicine to suppress the immune system, such as after an organ transplant, or if you have a disease that impairs the immune system, such as AIDS. To prevent this, avoid the sun during the middle of the day. Avoiding the sun at its strongest helps you avoid the sunburns and suntans that cause skin damage and increase your risk of developing skin cancer. Sun exposure accumulated over time also may cause skin cancer. Wear sunscreen year-round. Use a broad-spectrum sunscreen with an SPF. Wear protective clothing. Cover your skin with dark, tightly woven clothing that covers your arms and legs. Avoid tanning lamps and beds. Tanning lamps and beds emit UV rays and can increase your risk of skin cancer. Become familiar with your skin so that you'll notice changes. Examine your skin often for new skin growth or changes in existing moles, prickles, bumps, and birthmarks. Physical exam is a type of diagnosis. Your doctor will ask questions about your health history and examine your skin to look for signs that may indicate melanoma. Removing a sample tissue for testing, biopsy, we talked about it. To determine whether a suspicious skin lesion is melanoma, your doctor may recommend removing a sample of skin for testing. If you receive a diagnosis of melanoma, the next step is to determine the extent of the cancer and give treatment accordingly. Determine the thickness. The thickness of a melanoma is determined by carefully examining the melanoma under a microscope and measuring it with a special tool. The thickness of a melanoma helps the doctors decide on a treatment plan. In general, the thicker the tumor, the more serious the disease. Thinner melanomas may only require surgery to remove the cancer and some normal tissue around it. If the melanoma is thicker, your doctor may recommend additional tests to see if the cancer has spread before determining your treatment options.